السلام عليكم ورحمة الله يا دكاترة، إن شاء الله تكونوا بخير. اليوم راح نشرح موضوع مهم جدا اللي هو الميجالوبلاستيك أنيميا. حقيقة ما راح نطب في كلينيكال كورليشن الموضوع، لا راح نجي من البيزك مال الموضوع ونفهم الموضوع، لأن هالموضوع الحقيقة تلخيصا إنه هذا السلايد اللي راح أشرحه هو راح يجي عليه MCQات وهاي سواء بالأطفال بسبب المادة. كان من سن الأطفال هي أكثر سؤالين يسألون بي. من المواضيع المهمة جدا هاي يلد ننسل بها MCQ أوسك. أول شيء إنه حبيت أسولف إنه فد مقدمة على الميجالوبلاستيك أنيميا. الميجالوبلاستيك أنيميا هي لما يكون MCAV more than normal, MCHD more than normal, hyperchromic, microcytic hyperchromic anemia. Now, two causes: folic acid deficiency, B12 deficiency. راح نعرف شنو الفرق بيناتهم وشنو الأصل هذا الفرق وليش يحدث الفرق. اولا انه عندنا هذا باثوي يصح له فوليك اسيد ميتابوليزم. هي القصه منها تبدي من الفوليك اسيد ميتابوليزم، والتو كوزز مرتبطات يعني anyhow. So the first of all هو الفوليت. This is the folate, first compound of this metabolism. راح يتحول إلى داي هيدروفوليت DHF عن طريق انزيم ما مضطر تحفظه، اسمه داي هيدروفوليت ريدكتيز. داي هيدروفوليت ريدكتيز راح يتحول داي هيدروفوليت تو تترا هيدروفوليت THF، ثاني مركب لازم تحفظه. هذا THF راح يطب عن طريق هو راح يكون الفانكشناليتي مالته هو 1 كربون يونت ادد، راح يتحول الى الاكتيف فوليت. الاكتيف فوليت هو الفورمايل THF، ميثانيل THF، ميثانيلين THF. This is so important compound or substance. Now, this is the active form. Purine and thymidine. Purine of thymidine is the major component of the DNA and RNA cell division. Okay, so when the DNA and RNA replication and transcription needed for purine and thymidine, the molecule that forms purine and thymidine is formaldehyde and methanol, formyl THF and methanol THF. Okay, so these compounds are reduced. The folate form a methyl THF. Okay, so the methyl THF. The methyl THF is the active form of the folate. Now, this is the storage form. This is the storage form of the folic acid. So the storage form of the folic acid is the methyl THF. The storage form of the folic acid is the methyl THF. The active form is the formyl THF, methanol THF, or methanol THF. Now, this methyl THF is so important compound. Now convert to tetrahydrofolate. Tetrahydrofolate is the now recycled to active form. This is recycling so important. Now, these recycling, or this is the pathway shunted needed the B12 by enzyme convert homocysteine methyl transferase يحولك لهوموسيستين ميثاين. ما نضطر تحفظني اسماء، بس انه اعرف انه البي 12 هاي مهمه جدا راح نحتاجها بعد شويه. راح نطبق البي 12 والفوليك اسيد ديفشنسي. البي 12 هو راح يحولك الميثيل THF الى تترا هيدروفوليت. This is the folic acid metabolism. خلينا نجي نفهم انه ليش الفوليك اسيد deficiency and B12 deficiency causes the macrocytic megaloblastic anemia. تمام. The folic acid now is converted to dihydrofolate, tetrahydrofolate, to active form, to purine, to thymidine. When this is pathway is shunted, block, no purine or thymidine. This is the major compound, purine and thymidine, to form DNA and RNA required for the cell division. When these compounds are not formed by the folate, now these compounds are not formed. Now the DNA and RNA can replicate it, can't transcript it. Now the cell is highly substance with the cytoplasm needed for replication, but the DNA not replication or transcription. So the cell may be megalo. So this is the cause of the megalo, because the cytoplasm is increased in amount. The cell, nucleus, or DNA or RNA can't be replicated due to purine or thymidine deficiency, due to the active folate deficiency, formal THF, methionine THF, due to folate deficiency. This is the folic acid deficiency or folate deficiency. Now, what is the reduced folate? Methyl THF. This is storage form of the folic acid. When there's excess amount of the folic acid, convert to methyl THF in the cells. These methyl THF needed in these shunted to recycle it as THF, which is the convert to active form. Okay, so reduced folate or methyl THF when there is B12 deficiency. These cycling is shunted, block. Now, the methyl THF not converted to THF. Methyl THF not converted to THF mean accumulation of methyl THF in the cells. Now, due to vitamin B12 deficiency, which required for these shunted, methyl THF, when their accumulation highly than normal, accumulated in neuron sheath, in the optic nerve, and the retina. Now, when accumulation in neural sheath, lead to neurological manifestation as peripheral neuropathy. Okay, so this is the rises of the neurological symptom. Okay, this is the rises of neurological symptom. إذن السؤال هو ليش ما يحدث neurological manifestation بالfolic acid deficiency? There is no accumulation of any compound. There is no accumulation of the any compound because this is the pathway shunted, because there is no methyl THF accumulation inside the neural cell. Now, if the B12 deficiency means the folic acid metabolism is working, now the methyl THF, the storage form, are accumulated inside the cells. This is due to the B12 deficiency. إذن هو هذا الأصل مال folic acid deficiency, B12 deficiency. ليش هاي يسوي neurological manifestation؟ ليش هاي ما تسوي neurological manifestation؟ This is the high yield topic need for your any exam or MCQ.